everyone, this is Dr. Vijay Anand from Aspirant Desk. So we are having almost 3-4 months for the NEET PG exam 2024. Provisionally, the date given was July 7th. Okay, so now we are going to talk some important topics, often repeated topics of NEET PG general surgery. Okay, so our motto is making surgery very simple, as well as we are planning to give more material to make preparation very easy. So we'll go into the topic. See, question is 30 years old male had RTA. So he had bruises over the chest. His pulse is 120 per minute and BP is 90 or 60 millimeter mercury. Respiratory rate is 40 per minute. Chest X-ray was performed, which was shown in the next slide. So what is the next most appropriate step? So the patient had RTA. He is having tachycardia, tachypnea, as well as hypotension. Okay, tachycardia, tachypnea, hypotension. So we'll move into the next slide, which is showing the chest X-ray of that patient. So what is the diagnosis here is the tension pneumothorax, because this is the collapsed lung parenchyma. This is the air in the pleural cavity, and we can see the mediastinum, trachea, and everything is pushed towards the right side. So this is a case of left side tension pneumothorax. So diagnosis usually it is a clinical diagnosis. We should not wait for an imaging. So the patient usually have tachypnea, tachycardia. The patient will be restless, having distended neck veins. Tracheal deviation is a late finding, so we should not wait for that finding should come, or that is not necessary to confirm the diagnosis of tension pneumothorax. Okay. So the treatment, next most appropriate step is immediate decompression. So the safety triangle, which is bounded medially by the pectoralis major and laterally by posteriorly by the latissimus dorsi and below by the line drawn from the at the level of nipple at fifth intercostal space, which is joining posteriorly the latissimus dorsi. That is a safe triangle. Okay. So immediate decompression in the safe triangle. So what is finger thoracostomy? This is a word given in daily recent edition, 28th edition. So finger thoracostomy is both diagnostic as well as therapeutic. Okay, that is actually like a ICD tube incision. We should incise adequate for size of finger in the safety triangle. Okay, and we should insert our finger inside the pleural cavity. Okay, that is both diagnostic as well as therapeutic. If the air comes, so that is a pneumothorax. If the blood comes, that is actually hemothorax. Okay, that is basically diagnostic as well as therapeutic. So that could be done in the at the place of incident. Like we don't have any other modalities like imaging is not there. We are not having anything else. So we should do the finger thoracostomy. That will diagnose the condition as well as that is actually a treatment for that condition. So previous year questions, the same tension pneumothorax topic is asked in a different manner. Okay, so they are giving clinical history of tension pneumothorax, and they will ask what is the next step, appropriate step, like the previous question. So needle decompression. So in 2021. In 2020 and 2023 NEET PG exams, they asked tension pneumothorax clinical history and what is the next step. Thoracostomy was the answer. And one more thing in 2019, what they asked is where you have to put the ICD tube. That is upper border of lower rib or lower border of upper likewise. That is basically, we should know where the neurovascular bundle is present in the intercostal space. Okay. Actually, the intercostal space, the neurovascular bundle usually present in the upper rib. Okay. Lower border of upper rib. So there is a two ribs. We are having intercostal space. So the neurovascular bundle will go in the lower border of upper rib. So we should put in the upper border of lower rib. Okay. Upper border of lower rib. Lower rib. Okay. You should make things clear. So lower rib. So either way, you should memorize upper border or you should memorize lower rib. So we'll take lower rib as a point. So if we are very much strong about lower rib, then we could add the previous question, upper border of lower rib. Okay. So upper border of lower rib is a site where we could insert the ICD tube. Okay. So these are the questions asked in the tension pneumothorax, and this is the most commonly asked topic in NEET PG exam. So uh, make a note of it and stay tuned in our YouTube channel as well as WhatsApp group discussion to get more questions like this previous year topic questions. So click the link given in the description to join our WhatsApp group discussion. Constant motivation for NEET PG preparation without any additional cost. Okay, so download our Aspirant Desk app for a smooth and stress-free learning. And what about this motivation? So every accomplishment starts with a decision to try. So you should try. Still, you are having more time. 3 months is enough actually for the smart preparation. 3 months is more than enough. So, but constant preparation, constant dedication, and perseverance is much more important. So you could not do work as well as preparation. It's not possible. Okay, if you are aiming to get the seat in upcoming NEET PG, take a leave from all your duties and sit down and read for 3 months, complete 3 months. Then only you could take your dream seat at your dream place. Okay. And all the very best from Aspirant Desk team. Stay tuned and spread to your friends. யாரெல்லாம் ப்ரிப்பேர் பண்றாங்களோ இந்த நீட் பிஜி எக்ஸாம்ஸ்க்கு ஜஸ்ட் ஸ்ப்ரெட் பண்ணுங்க ஸோ தே வில் ஆல்சோ கெட் பெனிஃபிட்டட் ஓகே அண்ட் தேங்க்யூ ஸோ மச் ஃபார் லிசனிங் ஆல் தி பெஸ்ட்